Alrighty, good afternoon. Welcome to today's talk on developmental milestones. We thank you all for joining us, and we're excited to be back in person for this year's Baby and Family Fair. We're going to talk about child development. I'm Amy Kimmel, and I'm your moderator. I'm a family care nurse, so that's TMH's postpartum unit. Been there for a year. Prior to that, I worked as a mother and baby doula and a childbirth educator for about 10 years. I'm also a mom of 3 kids, so lived lots of this developmental tracking. So I'm joined today by Dr. Brittany Schafer. She's a primary care physician with Tallahassee Memorial Healthcare Physician Partners, as well as Heather Bradford and Tina Gautreaux, both members of TMH's Pediatric Rehab team, and Brenda Gorley, she's a pediatric physical therapist. So get an introduction from each of y'all. Dr. Schafer, do you want to start?
Okay, sure. Are we supposed to speak into this? Mm-hmm. So I'm Dr. Brittany Schafer. I'm a family physician, and probably more important titles are actually wife of Gray and mom of Rachel and Nathan over there. So I moved to Tallahassee for training from Miami and stayed and have been raising our family here, so I'm excited to be here.
I'm Brenda Gorley, and I grew up in Tallahassee, moved away, was in Montgomery, Alabama for a number of years, and have been practicing 25 years in physical therapy.
I'm Tina Gautreaux. I'm an occupational therapist. I've been an occupational therapist for 25 years, working pediatrics. Wasn't born here, but grew up here in Tallahassee, went to school at FAMU, and have been here ever since.
And I'm Heather Bradford. I'm a speech therapist. I moved here about half a month. I think I've been here longer now than I was where I was before. So I've been in Tallahassee since FSU, a graduate from there in speech language pathology. I've been working with pediatrics for about 20 years, in the school system for a long time, so 3 and up, but now working at TMH since last August, working with pediatrics there at the outpatient clinic. So thanks for having me.
All right. Before we get started, I will just mention that if you discover questions along the way, we will take participant questions at the very end. So, Tina, for talking about child development milestones, parents want to know what skills they should develop by which ages, and I'd like to start by defining what we mean by the developmental milestones. Can you explain a little?
What developmental milestones are different excuse me, different skills that children should acquire by an age range. It's not the same for every single child. There is a range in there. Some children develop a lot faster than other children. So there's normally a range between 3 to 6 months for each milestone. Milestones are just important things that are skills that build upon other skills. For instance, sitting. There's a lot of other balance and core stuff that you have to do to be able to sit, prop sitting, and then you go into sitting. Once you're doing sitting, then you can transition into a crawling position and then crawling. So a developmental milestone is something that you need to meet, and then you build upon that skill.
All right. Can I get some definition also of some of like the language skills or social emotional, kind of other pieces?
Yeah. So language skills would start off with things like babbling, making sounds, then making approximation of words, then making words, asking. There's expressive, and then there's also
Perceptive, social.
Yes.
Mm-hmm. Yeah.
I'm going to my speech therapist over here.
We'll talk more about those, for sure.
Yes. And then for social emotional skills, children need to learn how to self-soothe. That would be a big social emotional skill. Being able to go to sleep by themselves. Being able to regulate their state. Now, we all know that toddlers have temper tantrums, and that is completely typical, normal behavior. It's getting past those temper tantrums to being able to regulate yourself so you're ready for learning and you're ready for exploring your environment.
Mm-hmm. My toddler is right in the middle of learning those regulation skills. So I tell her older sisters that she's learning how to be a human. It's not something she fully knows yet. So yes, knowing what those milestones are help a lot with coping with them and also guiding them. So I've seen that. Dr. Schafer, let's talk about the newborn stage. This is my favorite because it's what I chose to go into. I get to support parents through that. So what are the key developmental milestones that we see for the newborn stage?
So there's a lot to that, more than we have time for today, obviously. So some of the main things are, they're learning life outside the womb for the first time. They're learning how to interact with mom and dad in a very limited vision space. They're totally dependent on mom and dad for everything. They are learning how to feed, learning that they can trust those who are caring for them, and that actually those attachment skills and, or maybe not skills, but attachment and learning to trust has huge implications for years and years, even to adulthood. And so that is a huge part of it. Every day is a little bit more growth. So I think we'll talk a little bit more about that.
So for the development of a newborn, what should they be eating? What's the guideline for that?
So newborns should only eat breast milk or approved infant formulas. They don't need water, they don't need anything else than that. And it should be, if it's a formula, it should be mixed exactly as prescribed on the bottle or the package. They will lose weight after birth. That is an expectation because they were receiving constant, think about an IV flow for somebody in the hospital. You're receiving constant nutrition through the placenta and the umbilical cord. Babies are receiving constant nutrition from mom. After that, so they are going to that every 2 to 3 hour sort of, or ad lib feeding that we talk about. Sometimes you'll see the cluster feeding come about. So they will lose that weight for the first little bit and should regain their birth weight by 2 weeks. Those first visits with your family doctor or your pediatrician are so important to make sure they aren't losing more than they should be. Any baby losing more than 10% is a risk factor for a lot of other complications, and we need to make sure they're growing and attaining those milestones like we're talking about. So the important thing is babies don't need to have a full 4-ounce bottle the first day of life. That is not what they need, and so each day their stomach is growing little by little. Family care nurses are awesome at helping teach moms, and then we have the lactation consultants, especially for encouraging the breastfeeding, because that really is the best thing they can get. So, there's so much to this.
I know.
I love this.
Newborns are extremely complex. They seem like they're just little sentient potatoes eating, but no, they're very complicated. Little taste of it.
Big plug for getting in with your doctor early, within the first 3 to 5 days of life. And then you should be seeing your doctor really often those first few months of life, at 2 weeks and then 2 months, and sometimes every day if you need a weight check. Sometimes it happens and you need those. So follow up with that doctor as soon as you're in the hospital having that baby, or even pick beforehand. So just to set yourselves up for success and your baby.
Alrighty. So for past the newborn stage, you had mentioned that it's like a 3 to 6 month kind of range for a lot of the milestones. So let's talk about the 6 month stage. There's a lot that happens then. So each of you speak to the development that you would track in your field, and tell me a little bit about what you'd see at about 6 months.
Okay, do you want me to go first? Okay, all right. So for speech and language and also social emotional, we kind of cross over in the OT world and the speech world. We cross over quite a bit there, but I'll talk mostly about those first 6 months. I like to kind of think of it as a responding engaging and interacting. So it's a lot of that going on. And initially, like birth to 3 months, there's just a lot of just responding, taking it all in, responding to your voices, responding to noises in the environment, things that are, difference between a voice and maybe an environmental type sound. The vacuum cleaner, I always say, there's a lot of advice out there about whether or not to run the vacuum cleaner or not when they're sleeping, that kind of stuff that you think of. Recognizing familiar voices. Which voices do I hear all the time? Is that my mom's voice? Is that dad's voice? Is that noisy little brother's voice or whatever? Or big brother, I should say. That smile comes in pretty quickly. Sometimes it might be gas, but you definitely know when it's.
We'll celebrate it anyway.
Welcome all of it, yeah. But it definitely comes in very quickly in those first 3 months. Then you'll start hearing some cooing and gooing, little sounds that you'll hear of just contentment, being happy, maybe not being happy, maybe some squirming and grunting. And then you start to hear those real distinct cries, like the mama knows, oh, that's a I'm wet diaper cry, or oh, that's a different cry. So you really start to, they just kind of get in tune with each other. And so that's really fun to experience and just enjoying it. And I always tell parents, like, as a parent myself, I have 2 kids, and I had older women that were mentoring me saying, enjoy the moment. And when you're tired and lack of sleep and you're just grumpy, it's hard to kind of enjoy the moments, all of them, but really do, because they really are, they go by quickly. So I have a senior graduating, so I got a little emotional just then. I can just tell, so just ignore me if I start getting weird. So the emotions are all up in here. So 4 to 6 months, gosh, they start really looking around. So at first, like Dr. Schafer said, you're kind of all up in their face and everything's close and you're seeing each other. But then they start to get a little bit more where they're like, what's over there and who's that? And they start really tracking, responding to your voice if you're kind of in the kitchen a little farther away, or, I'll be right there, and that kind of thing. They really do start responding to your tone of voice. And honestly, even your body language, like they can tell if you're stressed, especially nursing mothers. I know parents can have attributed to that, have mentioned that before, their observations. Babbling with sound starts to come in. You start to hear more parts of words like ba, lots of lip movement, ba and pa and ma. That's when you might start hearing like mama and dada and things like that. Lots of laughing and gurgles start coming out, those little giggles, those belly laughs. Oh, I love those. Those are fun. And those continue, so those are nice. But when you first start hearing them, those are fun. And then expressive excitement and displeasure. So both of those, you start to really tell when they're really excited or when they're really upset. So a lot just in the first 6 months with expressive and receptive language.
Now with fine motor skills, it's all about, oh my goodness, I have arms and I have hands. They start staring at their hands just in awe. They start reaching out, batting, grabbing faces, grabbing noses, just trying to figure out, oh, I have this appendage, what am I gonna do with it? They don't always make their mark. Starting to grasp and hold on to items, little toys, rattles, teethers. They start dropping them. And then a little bit later comes the really fun drop game. I'm going to drop it and then watch you go and get it. That is typical development. A lot of exploration with food. Between 4 to 6 months, depending on what your doctor recommends, starting baby food, starting cereals, lots of exposures to different tastes are happening at that 6-month range. At first, they don't know what to do with their tongue. They push a lot of it out, a lot of tongue movements, but then they figure out how to take that down or how to eat it. And then I always say have 3-4 spoons around, because the one that you're trying to put in their mouth, they're gonna grab. So you get another spoon and you try to put it in their mouth and they're gonna grab that. And so you have another spoon ready because that other one went on the floor. So I always say have lots of spoons around, so you're not getting up and constantly washing or having to get that. Because they're learning that grasp. They're trying to figure out what's coming towards me, what can I do, what happens if I move my arms.
For the physical, it's their interaction with gravity and, of course, interaction with their environment, which includes toys, includes parents. But when they're newborn, they still have some tightness. They've been in that womb for a long time. And as they get 1-2 months, they're kind of stretching out a little bit more. As mom and dad lay them on their belly, they are beginning to get more arm strength, more neck strength, to be able to push up. By 4 to 5 months, they should be able to push up good with straight arms. 3 months, they probably have no more of a bobble to their head when they're in supported sitting. By 6 months, they should be sitting, usually more by the end of the 6 months, they're usually sitting. I'm not usually worried if they're almost sitting but not quite sitting at 6 months. If by 8 months and they're not sitting, ask your pediatrician to refer them. It doesn't always mean there's a problem, but certainly it doesn't hurt to get them in early. We talk a lot about red flags or things that are not necessarily normal that you may want a referral for a therapist for. And often what we see is that the baby, especially when they're younger, they're either too, what we might call floppy. They don't seem to have enough muscle tone. They're kind of more like a rag doll. Or they are too stiff in the sense that they just constantly stiffening up. Those would be red flags for a referral and for possible problems later on. If at 6 months they're sitting and they're just constantly arching their back, they could have reflux, which would mean a reason to talk to your doctor. But they also may have some movement problems. And so it would be good to get them referred for physical therapy, or at least to talk to your doctor about it. So that if they were going backwards, they're probably too stiff. We also see the problem where they're, once again, too floppy, have low muscle tone, where they're just falling forward. And at 6 months, they should not be doing that. They should be, if not sitting, near sitting where you give them a little bit of support, good head control. And by 6 months, they should be rolling as well.
And then I did want to add something too that we talk about all the time at the office: no containers or limited containers. And what that means is putting them in bouncy seats or all of these different things. Save your money, put them on the floor, have a nice little safe area. You can get a mat to put them down on. Lots and lots of tummy time. That's going to help development. If you keep them in a container or you keep them in the car seat, bouncy seat, trying to put them in the little activity centers, it's just going to delay development because they don't have the chance to move around. They're very contained and they don't get that movement that they need to integrate reflexes, to just work on where their body is because they're stuck. And so we say, save your money, don't buy expensive containers, put them on a safe place on the floor, and then have toys around them. Have toys that hang down so they can work on batting them, so they can work on rolling. You can have different mats on the floor. They even have really cool little water mats that have stuff in there that they can watch and they can push and move with their hands.
And Tina brought up something about this age group. I also want to add, before we move on to the other age groups, that another red flag or something to watch for is symmetry. If they're moving one arm a certain way, they should be not necessarily at the same time, often at the same times, but we don't want to see the child always looking to the right but not to the left. There can be a condition called torticollis where the muscle in the neck is very tight. It often comes with new births. The womb is still small, it hasn't been stretched out at all, and the child hasn't moved much in there. Sometimes a breech presentation can do it. Anyway, they will only look to one side, and what can happen is they can have tightness on the back of their head. And of course, they sometimes neglect the other side. And your pediatrician may be able to show you some things that can help with repositioning, but we're also happy to show you stretching exercises, kind of monitor home exercise program, and help you with that.
Yes, that is so important. The other thing, like Tina was saying, everything should be on the floor. We've talked about how they can roll at this stage and other things. So even a changing table, you should never take a hand off the baby. That is a risk for falls off a changing table. Children should never, ever, ever fall off if you have a hand on. And if they're rolling that much, change them on the floor. It's not going to hurt. You can put a mat out and change them. But it is very, very important. And I would say start tummy time as early as that umbilical cord is off. That way it's not damaging to it. And so in the newborn phase is the key time to start, because we also see plagiocephaly, which is that head molding. And different times if the baby is positioned only one way in the cradle. Unfortunately, one of my kids got it for sure, and we had to switch the way they were laying in the cradle. And so you do see that they do tend to look one way. If the outside world is only one direction, they're going to look that way more often, and then they're going to get a flat spot. And so just aside from the cosmetics of it, we want brain and skull to develop well. We want all of those things to develop correctly. But as far as a safety thing, along the 6-month age, they're grabbing all those things, as Tina said, and which is awesome, but they can also grab non-food things and put it in their mouths, especially if there's a toddler sibling around. Oh man, lots of those little toys get in their mouths and then they choke. So that is a real time that your house should already have been baby-proofed by that point, because they are going to start doing lots of things on the move. Some kids start crawling way earlier than you expect, and it's just better to be prepared in advance of that so that it's not an issue. Excuse me, sorry, I'm a little stuffy. But they can transfer those objects from hand to hand. So I guess we can talk, I don't know if we'll talk more about it in a little bit, but I do recommend waiting until your baby can sit. And is showing that interest in feeding. If you take a bite and your baby's like trying to get after it, that's a good sign that they're ready for trying some of those foods. And obviously able to bring foods to their mouth. There are some reflexes where they will expel food from their mouth, the extrusion reflex, more around the 4 to 5 month mark, I'm guessing. You guys can correct me if you have any more subtleties, but so they will kind of mouth foods and play with them, and that's part of the just exploration phase. So really, really important. So I typically talk to my families about both purees and baby-led weaning in a safe way. I think both can be a positive. So just very, very important to talk to your doctor about that. We'll talk more about allergenic foods later and when to introduce those, but I would definitely say, as a rule of thumb, no more than one food every 3, really more 4 days, to make sure there aren't any problems, any allergies, any rashes, anything that develops, so you can be monitoring that, and it's just easier on you. We're all tired at that phase, and so it's just easier to keep track of what the baby has had and what they've been exposed to if you wait and give them a chance. But definitely trying to start exposing them to the colors of the rainbow is really important. Don't just expose them to ice cream and pizza and chicken fingers at that age. Please don't do that. And definitely nothing with extra salt or added sugar. That is so important. They don't need that.
Diet.
And what?
I said, or diet.
Yes, yeah, no diet things. So just whole foods eventually without the added stuff is probably the best way to start, and just think about that because it's also good for us. So
I was going to add, just before we move past this section, that I had worked with my pediatrician and a infant speech language pathologist and OT with a lot of the feeding things at this stage with my child. And I just want to say, if you ever find yourself in that boat, it is extremely helpful to just have a little extra guidance. And it wasn't this big scary thing I had worked up in my head that there was something horribly, horribly wrong. It was just some feeding reflexes that were prolonged and stayed on board longer than typical. And so that 3-spoon circus was extremely helpful. And also guidance on what things to add in and when, because certain flavors and textures can make babies go, no thank you. Raspberries are a big no, apparently. So moving on past the 6 months, the next large milestone is a year. So each of y'all tell me about how we can support our kids as they approach that year milestone, and what are we looking for once they're in that age range.
Okay, so basically for speech and language, again, you've done a lot of that up close. I forgot to mention that earlier, like really spending time, all that time they talked about on the floor and playing, but also right in front of your face too. So you're on the couch, you're laying down, that baby's propped up, and you're just having a conversation. You're talking, you're making funny sounds, doing the raspberries, all that stuff. So really just playing, that kind of vocal play is fun too. So you can make the sounds they're making, kind of get that turn-taking thing going, that social thing we talked about a little bit is where we cross over. So they really start learning turn-taking like early on. So your turn, my turn, like that's just the basics of social communication. So so that starts out there too. So I want to put that plug in. By a year, as you guys have already can tell, and you guys have kids already, but some new moms in here, that first year, there's a lot going on. We're talking billions and billions of brain synapses going on. There's just a lot going on. I think of it as like a computer, because I'm not a computer person, but I think of just all the downloads that have happened, right? And all of those interactions and times that they've been in the different context. So moving past that 6-month mark into the year, even things like starting to recognize certain words. So we talked about understanding tone and maybe your voice. Up close, far away, but now we're getting into like really the words. They start having a variable like babbling, so you might hear more sounds coming in, maybe a little glottal sounds way in the back of the throat, like sounding like they're just really making lots and lots of sounds and repetitive ones. They might start using gestures and doing some imitation. That's why it's fun to have them up close too, because they get to see like eyebrows go up, see different facial expressions, maybe a sad face. So a lot of that play can happen too. So they start learning emotions just by watching you, whether you're happy or stressed. They might learn what a sigh is, right? Because we're tired and tired of picking up toys and all that. But so they start learning a lot of that. A lot of imitation is going on in that second 6 months. They're starting to understand intonation too. So if you're asking a question, are you hungry? I mean, I'll be honest, even my dog, I'll say, are you hungry? And she's like, yes, So we know that humans are much more intelligent. So there's a lot of that going on too. They are really picking up on that. Their vocabularies are increasing. By 12 months, they say 1 to 2 words, but some kids have 3, 4, 5 words. So it's very, there's this range that comes with the kids. So, and sometimes, always remember too, a lot of times, that receptive understanding of those words is way ahead of maybe what's coming out. So you might not see it right away, but they have been, again, recording and learning about all of that as they go along, as they progress. Again, the consonants are coming in. As far as that play goes, I really encourage that, yes, on the floor, but just playing games, turn-taking, cause-effect toys. Once you push the button, this happens, and you responding, wow, and lots of clapping. Kids really respond to that. We celebrate a lot of the things that they do, and when they learn something new, the wave comes in, usually about that time too, so they're learning some social things. That's all I can think of at the moment. So I'll probably think of some more, but that's pretty much what goes on that last 6 months.
And building upon that with fine motor skills, as Heather said, we're starting to use our hands together. We're clapping now. We're starting to get that pincer grasp. This is really important because they will find a speck of anything on the carpet, they will pick it up. Everything goes in their mouth. But this is a good thing. This is how they build skills for more complex eating. When kids put toys in their mouth, they put different textures, they're learning how to grade their bite. They're rubbing on the side of their tongue, so they're working on reflexes like tongue lateralization. So to eat some of these more complex foods, we have to take a bite in the front, use our tongue to move it over to the back of our teeth, to chew it up and swallow it. So when they're putting all of these things in their mouth, they're learning how to do that and how to handle bigger things in their mouth. The only small things that I would give them are things that it's okay for them to put in their mouth and chew, like puffs, any of the little handheld meltables that they can take a bite off, that just take a little bit of manipulation with the tongue that get down to where they can swallow it. This is when you'll have start giving them a little bit of the food that you have on your own plate. They go from drinking bottles to mostly eating food. And this is, a gradual transition at about a year old. That's when they start to go into cow's milk. And so they're going to be getting their calories from food. Also, they also are learning cause and effect, the drop game. Let me take my cup and I'm going to drop it on the floor and I'm going to see what happens. You're going to pick it up and you're going to put it back on the tray, and I'm going to take it and I'm going to drop it on the floor and see what happens. That is just typical development. They are figuring out what happens when I do this. So a lot of knocking down, a lot of taking toys out of containers, and a lot of just, I call them, little Godzillas. They go through and they destroy everything. And they want you to build it back up, and they go through and they destroy everything. And that's just so much fun. They're starting to learn how to push buttons. They're learning how to isolate their finger and do a lot more of those small, fine motor tasks.
I gotta say, knowing that my child is being a little scientist to explore the world definitely makes it a lot easier to cope when they go and dump all the Duplos out on the floor and they're throwing their cup off all the time. Definitely a helpful way to understand their behavior as they experience it, rather than thinking they're just naughty, terrible.
Yes. And you know what? Links are your friends too. So if you can get some links, and if the cup has a little way to attach it, they throw it off, it doesn't quite hit the floor, and you can get them to work on pulling it back up.
So for the physical development, I think the obvious one is walking. And I always get the question, should my child be walking by one? When do I need to be concerned if they're not walking by? And to me, it's kind of all along the development of the first year. The question is not just the milestone, but the quality of the movement. Are they too stiff in the movement? Do they just seem weaker than other children, or what we would normally expect at that age? We have an epidemic of toe walking, where kids will walk on their toes, and that can delay walking. I've seen kids walk before a year who are walking on their toes. So just because they're walking a year doesn't mean that everything's just right. And I really feel like usually if there's a problem of some form, it should be discovered before a year. Now there are times when things are just so mild that we wouldn't, even the most attentive pediatrician, the most attentive parent wouldn't see it before a year. But usually if there's a problem, it would be seen before then. And it would be ideal for the referral to be made before then. If there's a severe problem, it would be great if it was made before 6 months. If it's more of a milder problem, it may not be discovered until between 6 and 12 months. We sometimes get patients coming in, and I will say they are usually the ones who are just a little weaker, a little bit more floppier, a little more muscle tone, maybe at 15 months for a referral for walking. The child is up, he is exploring his environment, he is cruising, he's pushing push toys, everything I would want him to do pre-walking skills. And so there's some things I can do, but I always wish I had seen him earlier, because I like to see kids, I can see kids at any time, but when I really get concerned is when they're kind of stuck in a developmental stage. And sometimes we see kids stuck not getting to rolling, or sometimes it's those transitional movements. They're just rolling late, or they're crawling late. And if any of the things those are happen, yeah, they're going to be walking late too. So if they could come in to see us before then, that's going to help everything. And just even when you think of how the physical affects cognitive development, all of that, that sometimes it's just a few little, sometimes I'm not always, but sometimes in 3 or 4 treatments, I can just help the parent unstick the child. They can learn a few exercises that just kind of help with their motor planning, and they're off and going. And so just the earlier they're referred, the better. So, and then sometimes if they're stiff, I can teach some stretches, which help make a difference too.
Oh, and I just did want to throw in there with Brenda, this is where we see a lot of delays with containers. Kids that are in the walker, so they sit down in, a lot of times you'll see them push backwards with their feet. And so what that does is that teaches them that their center of gravity is behind them, or they just lean all the way forward and run on their tippy toes. And so that's where you get that delay in walking, because their center of gravity they've learned is either behind them or in front of them. And so whenever they're trying to stand, they're either leaning backwards or forwards, and they have problems with walking and things like that. It can be delayed because they've just learned that the center of gravity is not where it really is, and they should be instead cruising around and doing things like that. So I would save your money on the walkers. Now, Brenda does use a lot of the push toys, and that's different, but the ones where you sit them in there and they have wheels and they can go forwards or backwards, I would say save your money.
And I would say if at 5 months, 5 to 12 months, your child's always on their toes, I would like to see them. And once again, that's something that sometimes at that age, 3 to 4 months, 3 to 4 visits, I can show you some things that can get them off their toes. I have 8-year-olds who are coming in who've been walking on their toes for 8 years. That's hard to change. And then you can think about how hard it is to change 2-year-old behavior. So just once again, the earlier things get addressed, the easier it is. Now, 2 months, that's another issue. Sometimes it's just certain reflexes haven't integrated yet. Sometimes there is a problem, but definitely between 6 months to a year, sometimes even 5 months or so.
Some of what you ladies were talking about kind of reminded me, if your child ever goes backwards on a milestone, that is an automatic red flag. Your child should never lose a milestone. That is, call your doctor's office like that day. If you start noticing that they're, trying to think of an example, so anything, or a motor milestone, anything like that, if they were, walking all the time and all of a sudden can only crawl, that is a concerning thing. So at any stage, if they were doing something and then fail to do that, that is a concerning thing. I think you guys hit on a lot of stuff already. But yeah, definitely no cow's milk before 1 year of age. I think by 1 year, it gets a lot harder to get rid of a bottle. If you've been doing a bottle, they get more attached to it after that point. So if you can start to kind of phase that out gradually, that's a really helpful thing, and it will make your life way easier. Transition to some of the sippy cups or straw cups. Or
I like
things.
to do with water or diluted juice or anything else besides formula. I'll do a lot, have them introduce in a sippy cup, straw cups, even open cup. Kids can learn how to do that. Back in the day, we didn't have sippy cups. Even putting a couple ice cubes in some water, it sounds different. It's a little bit colder. If you use room temperature water, kids don't know what's going on, and it's just gonna come out of their mouth. So throwing 1 or 2 ice cubes in there can make it fun. They like the cold water, make it a game. I take a sip, you take a sip, and just make it fun. Kids learn from having fun.
And then the other thing would be, as far as nutrition, not too much milk. Once you start transitioning to cow's milk or other milks, we want to make sure there's enough fat content so their brains can continue to grow and develop. We also want to make sure they're not getting too many calories just from milk and other things that aren't healthy. And by that point, the food should be more their primary nutrition. So we want to make sure we're not heading into that obesity category, and so making sure those height, weight, BMI, head circumference, all of those things we're plotting on every growth curve at every visit with your child. And so too much milk can cause anemia. It can also cause constipation. So really, really important to make sure they're getting the right amount. And so around 24 ounces of milk is going to be the max, I would say, unless your doctor has prescribed something different with good reason.
And I'll say that's a pretty easy number to remember. There's 24 hours in a day, 24 ounces per day. It makes it a little easier to stick.
So yeah, the 8-ounce bottles every 3 hours, that's way too much. So I just would not even buy those, honestly. I think they're too much for us as adults to have an 8-ounce cup at every moment. Your kid doesn't need it either. The other things would be, as they're trying to grab those things with their pincer grasp, making sure they're cut up properly is super important. Never a whole grape, never a whole hot dog. Those are some of the most common choking hazards.
And popcorn's another one.
And popcorns, yeah, just avoid that. Right, right. So, yeah, scary thing. My sister got the Heimlich for peanut butter and jelly. Very scary. Lived, thankfully. But just to make sure you're watching them and eyes are on them when they're eating, because you do need to they're learning that, and that's not something they've mastered yet. I think we've kind of talked through more of the other stuff, but.
Beautiful. All right. We'll move ahead to the toddler years. So kids change a ton once we go past that first year. From age 1 to 3, there's a lot of development happening there. And what can parents expect to see in their toddlers in their development?
Okay, so we've gone from responding and engaging and interacting, right, to exploring so much more, like really leaving kind of their space. They've been doing a lot of exploring too in their non-movement space, but now that they're walking and going places and reaching things, and there's so many safety concerns with this, of course, but from a speech and language standpoint, they're really understanding more and more just every day. This is when you start to hear more words every day, putting 2 and 3 words together, asking questions like, Mommy, what's that? Like that comes in, or where'd Daddy go? So that kind of stuff. They can listen to stories. You can sit down with a book and turn pages. I don't recommend when they're really young to read every word if you have a wiggle worm. But you can just picture read. Like, don't worry about all the words. Just picture, oh look, there's the dog and it's running, and turn the page. Okay, turn the page, you're ready. Like, keep it going and kind of get to the end quickly, so at least they know there's a beginning and an end and we're done with story time, and try to extend it maybe the next time and maybe read some of the words as they get a little older. There will be books that they might request over and over. Read them, even if you're just like, not this book. But read them, because The Pokey Little Puppy was one that we read a lot, among others. But in our house, listening to stories, following 2-step directions even. So 1.5-year-olds and up can help clean up. So with all those toys you talked about cleaning up, they can pick up and put in just as easily, not as easily maybe, but they can pick them up and put them in just as quickly as they dump them out or took them all out. So just create those routines. They can do that. Go get this, bring it to me. Like, they can do those kinds of things. Speech is usually understood. That's all language a lot. So speech and language kind of gets a little bit weird. We usually speech. I worked in the schools for a long time, so everybody said, oh, you just go to speech. Well, that child, we worked on language a lot, but speech is more like articulation. So all those sounds we were talking about, the babbling, those turn into words, and sometimes the sounds don't sound accurate. So you might hear dough for go, among other funny little sounds and words. But you'll hear patterns maybe, or they're talking and you're like, I don't know, I know what that word is, but it didn't sound right. Like, that's the kind of thing you want to maybe talk to a speech therapist or talk to your doctor and find out if they're meeting those milestones or not.
Yes, but they shouldn't be able to say S and TH at 3 years old.
S and TH. Yes. Right. So let's see what else. Oh, some kids might stutter. Like in the 2nd and 3rd year, there is actually a thing called a developmental stutter. Every time I talk about stuttering, I stutter. But it usually comes in, there's usually a big vocabulary burst around 2. I mean, usually about 50 words by the age of 2, but then you'll just really hear those words coming in. That's when you start to hear every day, they're like, wow, did you hear what they just said? Like another word, and they listen to all the words, so they will repeat all of them, so be careful what you say. And then asking why even comes in at around 3. Sometimes you hear it a lot more at 4, but lots of whys. I know, we don't, over and over. Lots of naming objects, so you're doing a lot in your books and your places you're going and looking out the window at the stoplights. And I will talk more about it later, but it's just encouraging like play groups and playgrounds and interacting with small groups and things like that, play dates, things like that they call them now. But just a lot of interactions, meeting new people, animals, things like that.
So at this stage for fine motor skills, kids are learning how to do constructive play. So they're learning how to put blocks on top of each other. They're learning how to do puzzles. They should be coloring at this age, not in the lines, but taking a crayon and making marks on the paper. Between 2 and 3, they should start to imitate some of your lines, like doing a vertical line or a horizontal line, circular scribble. They start being able to imitate some play skills too, playing simple games with them that aren't very complex. You should be able to do. They're going to start using their hands differently so they can hold on to one object and manipulate it with another. So starting to learn how to turn or put things together, stringing large beads, holding onto something and pushing it through. So they're really learning how to use both sides of their body differently. And still between 2 and 3, we want them to use both sides the same. After 3, closer to 4 is whenever we want them to pick a side. But at this age, they still should be using their left as much as their right. You shouldn't be able to say, oh my goodness, my child's definitely going to be a righty. That's a little bit of a red flag if they're not using one side like they're using the other side. With feeding too, a lot of exploring with different textures, different taste. Kids should not eat one certain group of food, like squishy foods or crunchy foods. They should be eating a wide variety of textures. Now, they're not going to like every single vegetable out there, and that's okay. They're not going to like every single food out there, but you should be giving them lots of exposures to different foods. Now, it is so typical for a toddler one day to eat everything that you put in front of them, and the next day they don't want to eat anything or they eat like a bird. I always say it's more of kind of what they eat in a week than necessarily one specific day or one specific meal. I like to set my families up with 5 different meals or snacks a day. I know that sounds like a lot, but that's breakfast, a snack, lunch, a snack, and dinner. And if you don't feel like they really got a lot of food, you can do something at the end of the day too, after dinner time. But having a protein, a carbohydrate, and a vegetable in front of them at all of those, and not just giving the same foods every single time. They might eat one thing on their plate and not touch the other 2 groups, and that's okay too. You at least want to give them something that you know that is a safe food that they like to eat. But if you don't expose them to different foods, then they're not going to learn how to eat them. And learning how to eat foods is starting off with even just looking at the food, having the smell in front of them, maybe squashing the food, putting it in their mouth and spitting it back out. That's still a positive experience with food, and they need lots of positive experiences with foods before they'll eat them. And that's okay. But if you say, oh, my child only likes goldfish and they only like chicken nuggets, and that's all you feed them, that's all they're going to learn how to eat. So giving them a wide variety of foods, even If you don't think they're gonna eat it, that's when they normally blow your mind and they eat, you know, something you're like, I didn't think they would eat that. But definitely lots of exposures to different foods at this time.
So with the physical, a lot of it is early playground skills, running, jumping, climbing. And with typical development, you really don't have to teach a kid to do those. It usually just comes. Your role is more in safety, making sure they're not jumping off something inappropriate, jumping into something appropriate, running in the street. I do like to, by around 3, it is appropriate for a child to be riding a tricycle, so that's something you could introduce then. Of course, swimming at an I'm not saying they should be swimming, but that is for exercise and for exploration within safety limits. It's just good activity. And if they are not doing what their peers are doing, often many of them are already in a preschool program or something like that, and sometimes things stand out a little bit more, then sure, they might need a referral. There have been some kids who were just kind of mildly delayed, who were walking at 13 months or so and weren't really any red flags shown, but they just aren't quite keeping up with the other kids. And there's some things we can do to help them with that. Another thing I want to just kind of put out there as far as things to look for is W sitting. I don't know if that, you have a picture of that, but it's basically, I'm not going to show it completely, but it's where the knees are turned, they're on the floor, the knees are turned in and the feet are out. So it has the look of a W. And the reason why this is bad is it is loosening their knee ligaments here. It is twisting their bones inward. So instead of their hips being seated normally in their socket, it's turning the neck of the femur inward. And it can result later in life in early hip replacements and hip arthritis. So very important when the child is sitting on the floor, playing on the floor, just crisscross applesauce, Taylor sitting. My day we called it Indian sitting, that's no longer appropriate, but just sitting with their legs crossed is very important, and discourage them from doing that W sitting position. And often if they are W sitting, it can be, not always, but sometimes a sign that they have looser ligaments and that they just might need to be screened for a few other things.
So all awesome points, and it's just a fun time for exploration and growth along all of these ages. I think one of the biggest things you can do as parents is model these behaviors. Model it at family dinners. Those are less common nowadays. Put your phones down. They don't need to see you on your phones all the time. They need to know that they're more important than whoever's texting you, honestly. Sometimes there are exceptions, but overall, eye contact, reading, doing all these face-to-face activities, as we talked about, they learn how you're reading or how to read you, and that's how they learn to interact with the world around them. So if you show them that, you know, family time is fun time and that's dinner time, they're gonna have a more positive outlook on how they eat. They're gonna learn how to interact, even taking them to the grocery store. We do Instacart all the time nowadays after COVID, and all these post-COVID children are growing up in a different world, but I think learning how to interact, day-to-day interactions are really, really important. And so don't let your child miss out on that to keep on such a schedule or other things. So I think that's really, really important and maybe could be missed. But the emotional intelligence is just as important as the IQ that we talk about. So, and those, a lot of times we see, I think, delayed, I feel like I've seen delayed more often. So, another plug is just for those regular visits with your doctor. It may seem like nothing was done. I get that comment a lot. Oh, nothing was done at the visit. We didn't get shots, so we didn't have anything done. But it really is important. And there are certain times at the 9, 18, 30-month, and 2-year-old visits, we're doing formal developmental screenings, and those are really, really important. So don't miss out on those. I know there's been I guess, less children coming to their well visits since COVID. So that is a concerning thing and a concerning trend. So that's not just my office. I know that's other physicians and other providers throughout the world and throughout the US. But just want to make sure they're getting plenty of activity, not too much screen time. We're seeing increased need for kids to get glasses at earlier ages because of screen time. They don't need a screen. They really should not. Give them a book, give them a puzzle, give them something to interact, their hands. All of these things just help their growth and development. They need outside time. Wear sunscreen, but get them outside. That's really important. Let them wash their hands when they come in if they're dirty, but they need time to explore in the house and get dirty. Yeah, my kids have dirt all over their faces all the time, but it is really important, and let them help. They feel part of a family if they're able to help. Maybe it's, pick up your toys before dinner, or it's, can you throw this in the trash can? Those are all really helpful things, and one of the things I do assess is, can they follow those commands as we talked about? Can they follow up and do things like that? By certain ages, they should be undressing themselves, and it drives you crazy, but they should be trying to take off their diaper, trying to help. At a certain phase, they should be gradually getting themselves dressed independently. All those things are part of their growth and making sure they're meeting those milestones appropriately. One other thing that kind of has changed in the past few years is, as far as nutrition goes, is if you are breastfeeding, the recommendation for AAP, the American Academy of Pediatrics, and then family physicians as well, has caught up recommending that breastfeeding is good too. So definitely a good thing. That's following what the World Health Organization says. And so I know there are some lactation consultants out there that are awesome as well. And it is challenging, but it's really worthwhile, and it is the best thing you can give them. But just, I think eating the rainbow is a really good way to think of it, not sprinkles, but the rainbow of all different colors on their plates, because it does force you to get all those food groups that they need for proper brain growth and development. If they're not getting the right things, vitamin deficiencies may happen, but please, please talk to your doctor before you give your kid lots of vitamins. There can be vitamin toxicity that results in more harm than good. Gummies are a good thing to stay away from because their teeth don't need it. And the dentist will appreciate you staying away from the gummies. Yes, exactly. Yes, exactly. So the goal is nutrition from food, not even from vitamins, but if you need to, there are those as benefits. But that, and then...
the topic of allergens, you started to touch on
before, I think. Do you want me to do that? Okay. So as far as allergens, so I do typically recommend, there's some discussion lately closer to four months. I still kind of recommend around 6, but between that 4 and 6 month mark, starting to introduce some foods. And there are some companies even that make it super easy for you. If you're doing bottle or spoon-fed feeding, you can mix a tiny grated amount of, peanuts, egg-type products, and different, there's a third one that's usually in the mix there. Sometimes, the tree nuts or peanuts are together, and then sometimes fish, but it's not usually ground up in a powder, but fish is one of the other ones that is early introduction. So you don't want to avoid those things. We've actually learned that by trying to avoid them, we've caused more allergens. So I would just do it in a very careful manner. The cheap way to do it is some peanut flour, and you should talk to your doctor about it, but it is basically what they're doing in those powders. But the goal is you just don't want to avoid them. But like I said, every one food every 4 days, so that you don't have questions on what was the cause of the problem. And if you ever notice swelling around the mouth or difficulty with breathing, any increased work of breathing, that is an automatic red flag that you need to go discuss that with your doctor. If a child develops a full body rash, or you have a family member that has maybe anaphylactic rash or anaphylactic reactions to certain foods, that would be worth talking with your doctor way before trying those foods out, just to make sure you have a plan in place and you feel comfortable and that discussion has been had.
Mm-hmm. I was going to say, to that point, my family has lots of allergies, yay. We carry EpiPens, and my nephew was starting to introduce foods, and the plan they made was for him to eat those at a well visit appointment, so that if anything were to happen, that he would be right there with medical providers. So if you do have a family history, that's one option you can explore with the physician. Yeah.
just communication is the key. And I think at least with my patients, I always err on the side of, let's get you in, let's get early intervention is the most key for everything. For if we're worried about autism, if we're worried about just gross motor delay, a language delay, anything like that, earlier is always going to be better for your child. So if you have a question, a concern, write them down. It's always, I would say no question's a stupid question. It's just better if you need the reassurance and your child's doing great. It's also just helpful. So just having that relationship is really helpful. And I mean, we have some awesome team members in this town to help